Sometimes the things that are so simple are just too easy to ignore. They're not fun enough for practitioners to do in their practice. And these things make a big difference overall. Now, the next part of management is sleep. So we're going to spend a little time here because sleep is really key to being able to help mitochondria function. So when we look at the physiological impact of sleep, it activates fusion and mitophagy, removes unhealthy mitochondria. It activates autophagy, which removes cellular debris and unhealthy cells. It increases in melatonin and anabolic hormones, promote tissue repair and mitochondrial biogenesis. Releases growth factors to support plasticity. And then it helps with consolidation of working memory to long-term memory. So these are all key things, but the mitochondrial effects are what we're really interested in. And when you look at sleep function, the ability to fall asleep, the ability to stay asleep, the ability to recover from sleep are what you want to find out about. So we're going to go through each of these step by step, okay? So the ability to fall asleep. The most obvious place, again, to start, basics. Limit your caffeine intake later in the day. So some people are still drinking coffee at 3 or 4 o'clock in the morning without sleeping well. They may not need to do that. Avoiding electronic devices before bedtime. Using blue light filter for electronics. Avoid exercising too late in the evening. Exercise earlier in the day. Keep temperature in the bedroom comfortable. These are the very basics for sleep hygiene. So you want to see if those are happening. And then when you're looking at people that have inability to fall asleep, the psychological stress, if they have psychological stress, then you have to improve their adaptation, which is really social groups, physical exercise, movement, some sort of stress relief or support group to make a difference there. And then metabolic syndrome is a key factor. So remember, the reticular activating formation, if it's getting activated too much and it can't be inhibited, it's going to cause wakefulness and inability for a person to fall asleep. And this is where GABA is used to inhibit this pathway. So the key thing with these is really getting blood sugar under control. For some people, it's really just about too much stimulants throughout the day and really getting their metabolic blood sugar pathways under control. If you ever have a patient with neurological symptoms on the metabolic assessment form, carefully look at the vestibular cerebellum area. Lots of people have cerebellar degenerative disease secondary to gluten sensitivity because gluten cross-reacts. If you have a patient with serious history of celiac disease or gluten sensitivity, you definitely want to look at those symptoms very well. So be aware of those mechanisms. That the inability to stay asleep, physical activity during the day, and this is maybe important for them to function as well, because they may have to burn off their excess catecholamines. And sometimes they'll need to work out, even though it's not in the evening, but they might have to work out in the evening before they go to bed, so they burn off all that extra adrenaline that they have in their body, whatever the reasons may be. They want to reduce their stress response at night, so trying to avoid things really at nighttime, overstimulating their brain at night times. There's nutraceuticals they can take to support their GABA pathways. We'll go over that in a second. They may listen to music therapy. Any kind of like relaxation music here for sleep is less than 60 beats per minute. And then if they're in a ketogenic diet or even fasting, you should be aware that sometimes people get hypoketonemia. Their ketone levels drop at nighttime. So for those patients, they have to take something like MCT or exogenous ketones before they go to bed. So just like people get nocturnal hypoglycemia, it's people that get nocturnal hypoketonemia. Be aware of that if your patient is not having a hard time falling asleep because they just need more fat and their adrenaline is pumping up to burn body fat because they don't have enough fat in their diet, so they can't really fall asleep. Okay, difficulty staying asleep. Biggest cause is nocturnal hypoglycemia. That's the person who has their blood sugar drop in the middle of the night. And then those that have vestibular neurological related issues have a hard time staying asleep, and then metabolic conditions. So remember, with reactive hypoglycemia, they're not eating enough to make glycogen, so they don't have enough fuel to supply them through the night. They get in a sympathetic response, release epinephrine or norepinephrine in the middle of the night to initiate gluconeogenesis to break down proteins, and that's what causes them to wake up. And then for some strategies to help people be able to stay asleep at night, which can be very effective with fatigue patients, is using weighted blankets. So weighted blankets cause deep pressure stimulation, and these deep pressure stimulations have been shown to decrease cortisol, increase serotonin, dopamine, increase GABA. They have this like someone's hugging you, holding you effect on the body, And for many people that have sleep disorders and MECFS patterns, a weighted blanket is a really good way to start having neuroendocrine effects while they're sleeping. You can get these off Amazon, any online supplier. And some studies that have really shown to be very beneficial. The use of weighted blankets is a safe and potentially effective way to help individuals in psychiatric facilities manage anxiety. This study found a statistically significant drop in anxiety for adults at an inpatient facility as shown by the STI-Y score and drop in pulse rates among patients using weighted blankets. Conclusion, weighted blankets showed positive impacts on falling asleep, sleeping the whole night, and relaxing during the day. And they were used frequently by children and adults in ADD, ADHD, ASD. So with these neurological deficit impairments that are really leading to sleep disorders, so they can't calm their brain down, it's not a blood sugar issue. You could definitely use white noise. You can definitely use these weighted blankets to help calm down their autonomics. Then music therapy is also something that can be very beneficial. Like music less than 60 beats per minute has a very powerful calming effect on the brain, has been shown to release endorphins and serotonin. You can download these off any of the iTunes or music's online suppliers that are available, whichever one you're using. But they're the kind of the music you hear if you ever get a massage and they're playing it. If you go to a spa, they have the massage playing, they have music playing. Those, like with a weighted blanket, can start adding up, calming down the brain so they can actually start to fall asleep. And they may have to develop a sleeping strategy ritual to be able to do that. White noise stimulation can be very effective with these people that can't fall asleep, that have energy issues, that's more brain-based. These really help people that can't calm their mind down. They need some noise to be consistent. And what white noise does is it changes your brainwave activity so you can stay in deep sleep, but also it prevents fluctuations of noise. It's the fluctuations of noise that make people wake up in the middle of the night. So when you have white noise, there's a constant, steady sound that helps with people being able to both fall asleep and stay asleep. Conclusion of data show that white noise significantly improves sleep based on subjective and objective measurements, such as complaining of difficulty sleeping due to high levels of environmental noise. This suggests that the application of white noise may be an effective tool in helping to improve sleep in those settings. Another key thing to consider with your really fatigued patients is mouth taping. So many people are not getting enough oxygen to feel recovered to their brain because they breathe through their mouth. And you really get most of your cerebral oxygen through breathing through your nose. So you can actually get mouth tapes. These are available. You get these on Amazon. They're very popular, very simple. They have a little filter there, so you can actually still breathe through it. And that allows a person to start to get used to breathing through their nose. And you may have the patient have a hard time with doing this at nighttime because they just feel like they're suffocating. They can wear it during the day while they're like working or at home in the computer. And then over time, they get used to breathing through their nose. And being able to breathe through their nose and then especially tape throughout nighttime can make a huge impact on energy for many of these patients. So this was a study that was conducted, and they said patients slept with nasal level ventilation at their usual settings on 2 nights in random order. On one night, the mouth was taped closed. Leak was measured with a pneumotachograph. And then the prevention of mouth leaks, improved ventilation, greatly reduced arousals, and markedly increased REM sleep. So they were able to avoid leaking of air through their mouth, and they were breathing through their nose, much deeper, restful REM sleep. And getting into deep REM sleep is where you start to get mitochondrial biogenesis and fusion and fission and so forth. And then if you need nutraceuticals to help with sleep, CBD, phenomenal. Kava, these are all compounds that are very powerful GABAergic activity. They can help a person fall asleep. Passion flower is pretty good. Magnesium L-theanate is pretty good. Tryptophan, lithium, lavender. Now, melatonin I didn't put on here because it can disrupt sleep rhythms. However, melatonin may be essential for people that actually have MECFS because melatonin can also impact the Warburg effect, where if they have issues converting pyruvate to lactate, it's been shown to change that expression. Looking at someone to fall asleep, make sure that you see if you can find their mechanism. You get sometimes the mechanism for people that can't fall asleep because they're just the brain can't shut down. Whether it's early neurodegeneration, whether it's past trauma, whether it's neuroinflammation, whether it's mitochondria, the brain not working. You have to look at using weighted blankets and white noise and nutraceuticals to impact gamma pathways if you need to. and taping that works to really improve their oxygenation of their deep sleep pathways. And sometimes it's just the fact that ketone levels are dropping if they're in a ketogenic state, or just their blood sugar levels dropping in a nocturnal hypoglycemia, but you have to figure those out so they can actually sleep well throughout the night. So that's the second part of managing these patients with chronic fatigue. So manage your diet, get that stable, and then really look at their sleep mechanisms and optimize their sleep mechanism. The third essential part of managing patients with fatigue syndromes is you got to get the circadian rhythm under control. Just shows that disrupting molecular clocks have a huge impact on mitochondria. And the shift between melatonin and cortisol fluctuations change the dynamics of the mitochondria in a healthy way where you can actually make mitochondria. So when you get into deep REM sleep from normal circadian rhythm, you're actually making mitochondria and getting rid of unhealthy mitochondria. You're getting that real estate to improve with having injured mitochondria eliminated through mitophagy pathways and new mitochondria being developed. So really important. You want to have patients to change and synchronize their circadian rhythm, wake up the same time every day, go to bed the same time every day, work out the same time every day, eat your meals the same time every day. This is not going to work right away. A patient may not be able to go to bed the same time every day because they're not tired, but after the same attempt at going to bed at 10 o'clock after 10 days, then it works. And if they try to wake up at the same time every day, that can tend to work, assuming that there's something really driving these mechanisms. But they have to commit to a 10-day schedule at least to really rebuild their circadian rhythms. Be aware that now this physiological alterations that impact circadian rhythms will make it difficult. So maybe when they go to bed, they do have to listen to noise and take some GABA support compounds to fall asleep. And maybe they really need 8 hours, 9 hours of sleep. But if they can start to time these things and develop a predictable schedule, that's sometimes the only way patients that cannot recover, can't get out of a chronic fatigue pattern, finally get a chance to get out of it. The neglect of practitioners on optimizing circadian rhythm for their patients is very common, and it's a very powerful intervention that can make a huge difference with the fatigue energy patterns, also pain patterns.
Thanks for listening to Solving the Puzzle with Dr. Datis Karazian. Start your 7-day free trial at KarazianInstitute.com if you're a licensed healthcare practitioner ready to evolve your functional medicine practice. Explore over 300 hours of clinical training, masterclasses with leading functional medicine clinicians, and certification pathways. Or check out the Academy of Functional Nutrition and Lifestyle Medicine at afnlm.com. Whether you're on the path to certification as a functional nutritionist or simply want to optimize your own and your family's health, our skill-building approach builds real-world competence from the ground up. And lastly, if you're dealing with chronic health challenges, visit drknews.com for self-paced courses that help you understand and address fatigue, brain fog, autoimmune conditions, gut problems, and more using evidence-based approaches. The content on this podcast is for educational purposes only and is not intended to diagnose, treat, cure, or prevent any disease. Always consult with your healthcare provider before making any changes to your health regimen. Thanks for listening, and don't forget to subscribe and share with someone who might benefit.